all of your supplies. We don't want aids, gloves. IV start kit, right here. Each of you get one IV catheter to practice with. Our supply has not came in yet. I ordered it like at the end of July, so hopefully the lady emails me to get our supplies in, and you'll get another catheter to practice with. Okay, you need a saline flush. I primed this one while you guys were in class this morning, so a pre-filled or a filled 3 ml or 10 ml. The hospital does 10 ml pre-filled saline syringe. It's filled with saline. Here's my little saline. And you need this, I call it a micro adapter, standard bore set. It helps keep it intact with this thing, with your IV. You need your primary tubing. Tubing is good for 96 hours. At HRH, they initiate tubing on day 1, and they change it on day 5. Today is day 1. When is day 5? Friday. Some alcohol swabs are good too. I like to use a washcloth or a towel under my IV arm so you don't get blood everywhere. And you're going to verify your patient's name and birthday, correct? Huh? Yes, patient safety. Okay, so before we ever start an IV or any, primarily IV fluids, we want to assess our patient, do a good physical assessment. If we're going to start IV fluids, what do you think they're at risk for? Fluid volume overload or fluid excess, correct? Mm-hmm. How do we assess for fluid volume overload? Edema. What else? Pulses. What else? So, yeah, that's kind of circulation, not really fluid. Oh, what did you say, Katrinka? Lung sounds? Good job. Oh, Marcy. I'll give Marcy credit that word too. I thought you said it so. Okay, so lung sounds. If we hear crackles, do we want to dump this 500-liter bag into our patient? No. Oh. I didn't say it. Okay. When we start an IV, we want to start at the most distal end, down here. My friends and I in the ER, where do we like to put them? In the bend of the arm, because you can see it. It's big, it's nice, easy to visualize. But we're going to start distal. Little old ladies don't really like the hands. You have to work your way up because it's kind of also patient preference. If our patient had a mastectomy on the right side, should we use her right arm? No. If she had a stroke that affected the left side, should we use her left arm? No. Good job. If they have a dialysis shunt in the left arm, should we use the left arm? No. So kind of keep that in the back of your head. Okay, so we have all of our supplies lined out and our gloves.
What if they had 2 things? I'm not trying to
like if they have a mastectomy on this side and then they've had a stroke, it's kind of which one's the worst of the evil.
What if they had,
Can you start one in the leg?
You could start one in the leg.
I'm not. They had a stroke and then an IV in this arm.
If they've had a stroke.
On the right side or left side and then it's affecting this side and then an IV in this arm, what would you do?
Like a
or something
attached to that arm, yeah. Then I would use the stroke side.
Okay.
You're just gonna like have to pick the lesser two.
Right.
It just causes lymphadenopathy. It could increase their nodules, increases the risk for swelling to stay permanent in that leg, in the arm. You could go for the leg. Babies, you go for the head. Like if they're new, if you want to work in the NICU, they go for the head or the feet and the leg. And you have to have an order to do all that. So for today's sake, we're going to just be a general practice nurse. We're not going to learn about IOs either. We're not drilling in anybody's leg or arm. Okay. So when we go to look for an IV, where to start them, we're going to put them in the vein, not the artery. And you want to look at the most distal end. I like the hand. This guy has some nice hand ones. If you are up close, you can see this. Hey, we have a new IV arm, by the way. The other one looks like an IV drug user. This guy's brand new. Okay? I'm not kidding. And there's a couple hands to practice on too that we've got donated. But if you saw on this one, he has a couple like nodules here. You wouldn't want to stick there. So when you come to your checkoff, Don't stick there, okay? Okay, so we have his pretty arm, and we're gonna open up our IV kit. And when you're looking for a vein, do you have to have gloves on? No, sometimes it's nice to feel. And that probably shouldn't have popped out. So you have your little tourniquet. And you're gonna say, I'm gonna lift up your arm, Mr. Smith. And he agrees to it. And you're gonna take this. This is the tricky part. You're gonna pull one side tighter than the other and kind of tuck, make an X. Don't like lift up your arm, patient's arm like this. Make an X and push this side through. Okay? And it'll pop up their veins nice and big. And you can practice on each other just to see, because it really does pop up your veins. Some old school nurses like to use a blood pressure cuff to a manual blood pressure cuff to pump it up and hold it. I never do that because I'd probably forget that the blood pressure cuff was there. And you don't want to leave it on for more than 30 seconds to a minute. So you look, you find it, okay, this is the one I want. You're gonna take it off and get all of your supplies ready, okay? And then we're gonna come over here. Your textbook says to prime your tubing. Before you do this, I'm gonna rip this bag open. So you have this. You have your sodium chloride. I'm short, thankfully. So you can hang your bag. If I pull this plug and it's not been poked, inserted, the tubing hasn't been inserted to here, into the tubing, fluid won't run all over me. But if this has been primed with the tubing I'm going to do, fluid will go everywhere. So do we want fluid everywhere? No. Okay, so this is your tubing. It's primary tubing. It's good for how many hours?
96.
And then you have all this tubing from way up here to way down here. This end is sterile. This end is sterile once you take the cap off. There's this nice sliding roller clamp in the middle that goes down. So you want to close it before you spike the bag. It's called spiking the bag. So you're going to take this. We don't have a whole bunch of these with bags, so we're going to have to reuse bags and tubing until we get our supplies in. I hope it's this week. But I'll set some out. So you're going to take this straight in here and just go straight in. Don't try to poke the side, try to poke yourself. Okay, so you're going to squeeze this while this is clamped. And you're going to squeeze it till it's about halfway to a third full. And I'm going to use my bag as my trash can. Because you want all this fluid on the floor? No. Okay, so I have it half full. Can you all tell it's half full? Mm-hmm. I'm going to take this cap off. I'm going to sit it like this upright so I can use it again. And you're just going to let the fluid, you're going to watch it travel. If you open it all the way, it'll come really fast. It's dripping. Do you all remember how to calculate drips per minute? And water's running into my little thing, so I'm going to roller clamp it closed. Say this little cap fell on the floor. All over the hospital, there's these cute little blue, are they still blue?
Mm-hmm. Yeah.
Mm-hmm. They're a little different than this, but they're cute like this too. These cute little blue caps. And they just fit in on the end of the tubing. Because do you want this tubing on the ground rubbing around? No, that's bacteria. So I'm going to sit this over here. So does it make sense how to prime tubing? At the hospital, you're going to put a little label on here that says change on day 5. And you have to calculate what day. So today's the 19th. 19 plus 5. Well, actually it's 4. 19 plus 4 is the 23rd. So change on 8/23. They changed all of their tubing at 9 p.m. So if I had tubing that said 8/18 or change on 8/18, you need to change it that day. On top of this bag, when you go to pull new bags from pharmacy, from the Omnicell now, it prints a nice label with the patient's name, what drug it is, what room, and their account number. You have to put, though, that when this fluid expires, and it expires in 24 hours. So this would expire at 8:20 at 1:46 p.m. Does that make sense? They proof on the label. You have to have your patient's name and their date of birth, what the drug is, and when it expires. Okay. So we got all that ready. And it's nice. Some nurses go ahead and put the IV in and then get all their fluids ready. Your textbook says to get the fluids ready and then do the IV. So it's either way. But we found our spot and he's chilling, he's happy. Mr. Smith is a great patient. And I'm gonna get some new clean gloves. And Mr. Smith, how you doing today? Great.
Do we need to wear gloves while we prime it and stuff?
No, you don't have to wear gloves because you're not touching anything. You're not gonna get AIDS doing that. Unless like you're hanging blood, then wear gloves. And there's some nurses don't wear. Okay. So I got my IV start kit. It tells me what's in here. Gauze, a dressing change label, alcohol prep pad, antiseptic applicator, tourniquet, and securement device. Okay. I like to lay all of this out so I can see it. It has this fancy stat lock. And this thing clips onto the IV. And I'll go over taping in a minute, but just be aware. Please don't put tape on the mannequins. If you want to practice taping, tape on this or the back of the glove box, because this makes this mannequin really sticky. So I'm gonna lay the tape down on him and I'm gonna put the tape on, but I don't want you to. Okay? And I'm also gonna get my adapter. I'm gonna prime this with saline. Because we want to prime it with saline because we don't want to give our patient air embolism, right? We don't want to just inject air. So you see the fluids moving up. And there's a little bubble. I set it right back in this package because this package is sterile, okay? Okay, and I got my IV ready. And I have my stat lock. You're gonna have a tegaderm. Huh? Oh, yeah, I can move my box. You can return your movie there. You just might have lots of late charges. Okay, and you also need the skin protectant pad because it helps it stick and prep the skin before you put it on. Okay, all right, Mr. Smith. Got my tourniquet back on. And I like to take this tegaderm thing off to have it ready. I know, it's me being weird. Okay. Don't leave this on for more than a minute. Don't time me on this video. Okay, and now I need my chlorhexidine. And you always want to clean your IV site with chlorhexidine. Chlorhexidine kills for days, not hours. Like alcohol. And you're going to scrub back and forth for 30 seconds to a minute. What if we had like a 2-month-old, like a 18-month-old patient? What could we do to help decrease the pain of an IV site? We could numb it with lidocaine cream. We'd put that on 30 minutes and cover it with a tegaderm before 30 minutes to an hour that your book recommends. Or in the ambulatory care unit, they inject, like with a TB syringe, inject lidocaine next to the vein so it numbs the area, okay?
Do you have to have an order for lidocaine?
You have to have an order for lidocaine because it's a medication. I think in ambulatory care, when you do all your IV sticks, they have a standing order for surgery patients.
If
Okay.
the kid's young enough, don't they use the other one, not the
The cream?
chlorhexidine, but if it's an infant, they don't use the chlorhexidine.
Yeah, if they're less than 1, you probably shouldn't use chlorhexidine. But okay, so we cleaned our site. Are we gonna blow on it? No. I saw something stupid on it. Oh, that's a stupid joke. Okay, so for today's sake, I'm not going to hit this button when I put my IV in, and don't hit the button when you practice. But don't stab yourself either, because you only have one IV needle per person, okay? So you won't be that close, because it'll be real life. Okay, you're gonna hold the skin nice and tight, okay? And you're gonna hold the vein.
Have your bevel up.
Yes, and bevel up. Sorry, bevel up. You can't see the bevel. It's like the TB test. Remember the bevel up on the TB test? Come back to haunt you. Okay, so you're gonna go in at a 5 to 15 degree angle. You're going parallel with the skin, okay? You're going to see a flash of blood. Oh, I see some blood. And you're going to hold pressure above the sites. Okay, I'm holding pressure. I'm going to release my tourniquet. I'm going to pull this needle straight back. Set it far away so you don't stab yourself. You're going to take your pre-filled saline with your lure lock, and you're going to flush it. You can pull back and be like, ooh, I got blood in my tubing, I'm doing awesome. Or you can just slowly push the saline in. It's going good. If it's infiltrated around the skin, you'll see the skin start to swell up. If the patient says it's burning, you want to stop, assess the site. It might be irritating the vein, or they have phlebitis. I'm holding it still. You're going to come over here. You're going to take your tegaderm that likes my glove and tape it down and peel off the tan part. Ooh, the tegaderm does not like our friend over here. I'll show you this in a minute, how to tape. Okay, taped it down. Then we're going to take our stat lock and take that over the top. It clips onto the blue part. If I will show you guys again on this. It's gonna snap. Oop, it snapped. And then you pull the butterfly rings. Pull the butterfly rings. And it looks like it's pretty secure. So you can undo, I can't do it in two hands. I gotta have two hands, sorry. You're gonna undo this. You can clamp this, but this has a negative pressure thing that fluid won't come back out. So I don't clamp it, but some nurses do, so you can clamp it. And then you're gonna take these two little wings. Some nurses only use one, you can use two.
What are those called?
I just call them little wing things. They're like little pieces of fancy foam tape. It likes my glove better than it likes the patient. And when I do an IV in real life, because the small gloves my fingers can't fit into here, but in real life at the hospital, I use like the tightest pair of gloves so you can feel the vein. Jessica, would you agree?
Yes, and I have a question. You're doing that. I was taught I could be allowed to date an initial before you stick one of those.
Well, we at HRH have this fancy little sticker thing
Oh,
that
sweet.
date, time, and the gauge and your initials. So after you get all that off, I go ahead and take it off, use my trusty dandy pen, and add it on. Voila. Any questions? I know, it's a lot. So guess what? When you come practice the first time, what are you gonna do?
Ask questions.
Ask questions, come find me.
They do it a lot different. I think they do it kind of out of order, some of the nurses.
This is what the policy at HRH says
I'm
to
not
do.
saying you're wrong. I'm just saying. I saw they put the
The stat lock over the tegaderm?
yeah, and then they took the tegaderm is at the clear piece. They put that completely on top of everything
Yeah, well,
else.
this is what you're supposed to do.
What did you say after release tourniquet before you said tape the tegaderm? Release the tourniquet.
And then flush it, or tap the adapter, the lure lock. The lure system.
Double pressure above it.
Yeah, and hold pressure.
Well, that was
Hold
before.
pressure,
Then release tourniquet.
and then,
tap.
and flush this. And flush before you tape down, why? What if you taped all this down?
And then it would get out.
Yep. Do we want to shave our patient before we do this? If they're really hairy and you can't find the vein, do you want to shave them? No, we want to clip them. Okay. So now Mr. Smith, he's done great for us. And he needs, Dr. Moss ordered some IV fluids. If we have a 500 ml bag and it needs to go over 5 hours, what's our rate? 100 mils per hour. Also, when we have this tubing, we need, what's macro drip? How many drips per mil is that? 10 to 15. With macro, they have to give you the number. This one's 10 drops per mil. If it's micro, it's always 60. So write that down. You will have 5 math questions on this skills quiz. And I know you're all excited.
60 is micro?
It's micro, because they're small, anybody small. Macro, typically 10 to 15. Yeah, it's 20 minutes for 15 questions. If we're using an electronic infusion device, an EID, it's always mils per hour. Write that down. If you're using an electronic infusion device, what's the rate?
Always 15.
No, always mils per hour. So if we have 500 mils over 5 hours, did somebody say the answer already? 100 mils an hour. So we're gonna set our little, this little blue thing is called the key. What, I'm gonna like rat out the student, but Sherry told me she told the LPN students. Anna, oh my god, you draw a blank on her last name. Anyway, she's a new LPN instructor. You might see her around. She came in to do her checkoff. She was like a good student, very smart. Was an LPN first. She came in. She did not know how to use this pump at all. She just looked at it, thought she could do it. She know it. Didn't know what she was doing. Guess what she got on her skills checkoff? A 0. So this blue thing is called the key. Okay. So then you're gonna put it over here on this left side, and it opens the door, and it turns on the pump. I thought. Okay. It says, and this machine is really smart. It's saying open clamps. So it's telling you to open the roller clamp. Da-dun-da-dun. And it also says remove and open slide clamp, which is the key. It says keypad locked, okay? So write this down. If it says keypad locked, you need to enter the code. If you're like old like me, you used to do old school texting, and the password is KEY or 429. Okay? Because we're gonna be on PCU, Med-Surg uses the key lockout thing. Maybe OB does, I don't know. But if you turn it on, always choose PCU and we won't have to know that. Drug name for right now, you're going to type IV. So it's the old school texting. If you don't know how to do it, you'll get to learn. Does everybody know how? Okay, you're going to choose IV fluid because we're not going to give a bolus. And it says right here, primary bag. And your rate is going to be 100. And our volume to be infused is 500. Did we have to calculate drips per minute? No. Do you need to know how to do that for the quiz? Yes. Okay, so we're going to come over here. Before we ever use this patient's IV, if it's been sitting for a couple days, you want to flush it nice and slowly with some saline. This has been sitting here, it's dirty, I'm not going to do it. And you don't want to just sit this on the table if you're doing a flush. You want to open up an alcohol swab and sit it on there. So we swab this with alcohol, and you're going to screw this on. Make sure your clamps are undone. If you need another piece of tape, you can tape it up here to hold in place better. Can everybody see that? Mary, do you do IVs where you work? Yeah.
Well, I can't because in Illinois.
No, you can't. Okay.
I
Okay, so we type our rate, we type our volume to be infused. It says press OK to confirm volume to be infused. The abbreviation for volume to be infused, write this down, is VTBI. So in 3 days from now, you'll say, what does VTBI mean on this pump? And you'll be like, oh yeah, Mrs. St. Joanna said so. And I know it's the first day and you guys are probably already on
Is it-
over
Sorry.
VTBI. Oh, B
Right.
as in boy and then I as in igloo. Yep, volume to be infused. Okay, so you just hit OK. And then you're gonna come over here and you can stare at the pump for like a minute. It'll tell you what to do next. It says pump stop, push run to start or hold for standby. I'm gonna push run. And then it says, this is the last question. If you do not read this question and take 30 seconds to look at the screen, I will be disappointed in you. It says, are all clamps open? Is tubing not kinked? Are drops flowing? You're gonna look at it and say yes. So, and we're gonna look up here and make sure drops are dropping before we say yes, and they are. And we have started an IV. We've hung some fluids. And now guess what?
He's gonna live.
He's gonna live. Or he could die and now we have to take out his IV. But he's gonna live. So now it's time for Mr. Smith to go home. Oh, there's air in the line. So if there's air in the line, well, that's a good example. There's air up here in this system, and if you don't hit silence, it beeps forever. So we're gonna come over here and it says air in the line. I'll be like, dang it. So we're gonna open this up, and the fluid's just gonna run on the floor. We're gonna water it. Because it's just saline. You can waste a little bit of saline. If this was an antibiotic, you can't do this. And I'll show you in 2 weeks what to do for that. So we clamped it, okay? We got the water out. And now we're gonna try this again. We're gonna load the set. You just follow it down. And then it says load guide into 3 and 4. I didn't say that earlier, but it's like when you do this every day, it's hard to stop it. Okay. It says open roller clamp. I did. I'm gonna get my new alcohol swab. I would suggest, if I was doing this in real life on a real patient, I would put gloves on because you could come in contact with blood. Okay, and then you're gonna push run again. And it says, are all clamps open? Is tubing not kinked? Are drops flowing? Yes. And now we have fluid running. This guy's arm will be sitting over a trash can. Like this cord's kind of will be leaning into a trash can. So make sure you have that trash can or we'll have a flood on the floor. Okay. What questions do you have right now? I know I had a lot. Jessica.
When they're putting in the key, they need to make sure there's plenty of slack in there because if you
Oh, yeah.
like it, like you make that.
If you put the key way up here and it doesn't reach, you're gonna have to slide it down. So leave a little slack.
And then it'll come out.
Okay. So Mr. Smith has been discharged home. What supplies do you think we need to take out his IV?
Alcohol pads.
Alcohol pad.
gloves.
No, I really don't like alcohol pads for taking it out of IV. I love the alcohol hand sanitizer. So put it on your glove. But for today's sake, because we don't have any, we will use the alcohol pad. A piece of tape
And gauze.
and gauze. And I just take the little piece of tape and sit it on their bed rail or wherever's convenient.
Is it okay to do it on our hand?
Well, I don't want it getting in the way, but sure if you want to. So you're going to take your little alcohol swab and swab all the way around. The hand sanitizer, if you put the hand foam sanitizer on, just rub it all around. Okay, it just loosens the tape. It's great. Okay. And then you're just going to peel. I peel from the most distal from the IV to the closest. And then when you get to these little butterfly wings, you just kind of pull them up towards the middle, okay? And then you're going to take your gauze pad, which is right here. And you're going to take it, and you're going to remove it nice and slowly in parallel, okay? And pull it straight out. Make sure it's intact. You're gonna hold pressure for 30 to 60 seconds, okay? If they take a blood thinner like Coumadin, what, do you think you might need to hold pressure longer?
Mm-hmm.
Yes,
And you said for 30 seconds to a minute.
30 seconds to a minute. I think your book says a minute.
And so if they're on a blood thinner, like how much longer?
5 to 10 is what your book says.
For
Typ-
me?
typically in real life, 2 to 3.
Okay.
But your book does say.
So like if something like that was on the quiz, would we go by what the book said?
Yeah, what the book says. It's not. It's not a quiz, but just remember if you're
Yeah.
on a blood thinner, you're gonna hold it longer. Okay. If yes.
When we get supply them, are we allowed to try on each other?
No, you cannot practice on each other. Do not practice on each other. Do not take the needles out of the lab. Do not sneak one to your dorm room. Do not practice on each other. I promise you, you'll get to practice on some nice person that's gonna have a total knee or total hip. They're gonna have nice, healthy veins. Hopefully it's a male. Somehow males have bigger veins than us that stick out nice. But do not practice on each other. Okay. Okay, so let me review some things to make sure I said everything. Oh, also, Katrinka thinks she's the greatest IV starter ever. And Marcy's her patient. And Marcy goes, I don't care how many times you stick me. How many times do you think in real life Katrinka should stick that patient? No more than 2. If you were with me in clinical, I guarantee you, you're only sticking that patient once. I'm also going to tell you those nurses on PCU love us. And they're going to say, hey, Amanda, we have an IV for you. Do you want to do it? And I'm going to say, let me look. Marcy's patient's 105 years old. What kind of veins is that 105-year-old, 90-pound little grandma going to have? Nothing. We're not going to stick. If I say, yeah, we'll go look, and the patient's like, yeah, you can stick me, and I kind of just look, and I would tell Marcy to go look, and I get in there, and the patient's like, oh, took me 10 sticks in the ER, but you can still try. Do you think we're gonna try? No, I'm sorry, I'm mean. I don't want to be stuck 100 times. We're not sticking those patients 100 times. And when you guys do your ER rotation, you will get plenty of IV sticks.
Will we get to draw blood too?
Yeah, in the ER.
Oh.
Okay, before, I didn't go over this because I kind of skipped it. Before we start tubing fluids, is this a medication?
Yes.
So how many rights are there?
6.
Good job. A third to half full. What are we gonna do if it's not dripping? We started an IV, well, we had air in the line earlier, that's why it wasn't dripping. What else could we do? Do we just take the IV out and say, oh, it's a bad IV?
Check the clamps, check the position of the arm.
Check the clamps, check the position of the arm. If we put it right here in the AC space, every time they bend their arm, it's probably gonna be better. These pumps are better than what they used to be though. Make sure it's not red and that's not cool to touch because it could be infiltrated or phlebitis. It could be irritating the vein. Okay. And make sure once you get all this in, you open this roller clamp too. Once it's in here in this pump system, fluid's not just gonna run out. If I take it out of this pump system, fluid's gonna run freely. Does that make sense if you don't have it clamped? I posted this YouTube video. It's them doing the exact same thing. They may plug in a drug into their drug library. HRH is able to plug in drug libraries for all of the medication with the doses. Like Rocephin, you give 1 gram for 50 mils. It has it plugged in there, so you don't have to calculate it. It makes it really nice.
Do they
But
use the same pump? in the
it's the same pump. It's everything. Yeah, it's the whole system. It just like it says dobutamine right there. We're not going to be calculating mics per kilogram per minute in the skills lab. But you'll have to know that for your farm, or for pharmacology and all your tests, you know how to do that. So when we choose this, we're going to choose IV fluids, right? And you want to, when you remove the IV, you want to remove it nice and parallel. Check the site for any complications. If it did infiltrate, you need to document that. You don't need to say it was perfectly intact. So. All right, what questions do you have? None. I just did such a great job, you guys. So,
What do you do if you're starting an IV on their veins?
well, I just hold it nice and tight and it doesn't. And that comes, and people will tell you their veins roll, and they do roll, but if you hold tight pressure, like, I put my thumb down here and my other finger up here, or hold both up top at the site of the vein. If you hold, when you go to stick, hold the skin nice and taut, or to the side so you can hold the vein and see the vein. They may roll some, and I just work with it. And I will tell you, if you come into the ER, and not saying you're gonna be my patient, I am not as good as the nurses that do it every day. You guys, I know this is so new to you, and you're probably like, oh my God, I'm so nervous. The more you do it, the better you get at it. I'm really good right now because I worked all summer. Oh, they also have vein finders.
That's cheating.
I personally don't care for them because I didn't grow up with them, but they are great. It outlines the vein. I do use them, like on African American patients. Their veins are difficult sometimes to find. There's also now ultrasound guided IV start people in the hospital, and they're really nice to call on. They'll come, they'll use the ultrasound machine to start the IV. There's one patient though that doesn't even get success with that, so.
I cross-trained in your ER and they let me do some rainbows and cultures. And
Yeah. So, if you have questions. Oh, so I did not hit this little button. So, I gotta find my IV though. So, to reuse this needle safely, you're gonna just take this, set this down, and you're gonna scoop this on, you know, like you did back in the day. Just scoop your cap on, and it's back on so you can stick again. And I will help you with this. Okay?
When did this check off start?
The day after Labor Day. So you have all of this week. So I know you guys have, like, Thursday looks pretty busy around here. Like looking at the roadmap earlier when I was thinking, why am I here till 4 o'clock on Thursday? But that's okay. There's Mrs. Moss lectures before then. So if you don't have simulation, you can come practice then, and I'll be hanging around helping with simulation. So I can't like sit and watch you do every step, but. And you can email me to set up a time. I know many of you utilized that last semester. To say, hey, can you just watch me for 5 minutes? Yeah, you're so nervous, but yes, you understand what you're doing. Don't mess up when you come see me in a week. I mean, I watched you just do it now. I know you can do it, so. Do not go start an IV by yourself if you've already done it 20 times, Jessica. We have to go with you for every new skill, so don't forget. I didn't know that. So just don't do that, okay? So every new skill, don't forget an instructor has to go with you. Okay? Has everybody given a shot in the hospital? Haley has not, Keely has not.
No, I have.
Oh,
I thought you were asking if we had.
not in clinical?
I mean, insulin.
Like insulin, like, I mean,